Okay, so let's talk about nursing and servanthood, because servanthood is something that we see in the Magnificat text. Let me be clear, I do not think about nurses as servants. I'm not equating nurses with servants. What I am interested in, however, is this whole issue, which I think aligns pretty well, or maybe I align pretty well with it, with the concept of servant leadership. Um, that is leadership through service. In some respects, we might say that those two concepts do not work together, but I think there are ways in which they absolutely do. Because as we demonstrate commitment to one another, um, very often that's demonstrated in service. Jesus even said, the one that would be the greatest among you must be the servant of all. And I think that kind of idea, and I think you see it from other religious leaders as well. Gautama Buddha comes to mind actually most quickly for someone outside the Christian tradition. There's that idea that one gives one's life for another, and in that then exercises some legitimacy and leadership that you wouldn't otherwise have had. Um, so, where I think this is appropriate for nurses is it's easy. I say it's easy. I'm just maybe extrapolating a little bit from my wife's experience, where sometimes patients don't treat her with the kind of respect that I think she deserves. Of course, I get to be an outraged husband, right? It actually makes me think of that commercial. I think it's a candy bar commercial, and these people behave badly, and the caption is "You're not yourself when you're hungry." So you've got to eat this candy bar, and then you'll be yourself again, and you're not an angry, cantankerous, difficult person. Well, I think in the same way, you're not yourself when you're sick. You're not yourself when you're in pain. You're not yourself when you're dying. And very often, nurses confront people in those situations in life. People are in pain. People are hurting. People are sick. People are dying, and we're not our best selves at that moment. And nurses have to figure out how to navigate that, especially when people are difficult. Well, when we talk about servanthood, Mary sees herself here. Hey, my Bible upside down. Mary sees herself here in verse 48 of Luke chapter 1 as God's servant. Now, here are some other folks. Some of these names may be familiar to you, but other folks who were considered God's servant, or the Lord's servant, more specifically, Yahweh's servant in the Hebrew Bible. Moses is Yahweh's servant. Joshua, his successor, is Yahweh's servant. David, the quintessential Israelite king, is Yahweh's servant. Isaiah, if not the foremost prophet, one of the top three in the Hebrew tradition, is Yahweh's servant. Even Israel herself is Yahweh's servant. They're all considered to be Yahweh's servant. So when you dig a little bit, you prod a little bit in the Old Testament, you find that this is actually, every one of these people, they're significant people in the history of the Israelite body, right? And this idea of being Yahweh's servant is actually an exalted type. It's not something of low esteem, it's actually something of high esteem. And Mary sees herself in that stream. The use of that word servant is highly theological. It is not something to be taken lightly. Paul sees himself as God's servant as well. And I'm not saying that there's not humility involved. Of course there is. But there also is this echoing back of this other tradition. And it's interesting here that Luke uses a female. Certainly, this is unusual. to think of a female as Yahweh's servant. And yet, Mary kind of casts herself in that role here, or Luke's Mary, that is, Luke's portrayal of Mary, casts her in that way. And that's significant because one of the, as we've already discussed, one of the areas of emphasis that Luke wants to bring is this emphasis on the poor or the lowly being evened out, being brought up, while those who are oppressing are brought low. So Mary in the Magnificat sees what's happening in her life and then translates that out for the people of Israel in the last, let's say, 5 or 6 verses of the Magnificat. Mary is God's servant, but that experience as God's servant impacts those around. And it seems to me that this is a perfect connection with nursing. Nursing gives dignity to others rooted in their own in their own sense of dignity and worth, sometimes doing really, really difficult tasks. I mean, I've talked about the difficulty of patient personalities, but then sometimes just the nursing work itself is not something. Sometimes it's difficult. Though even if the patient is not difficult, the work itself is difficult. It's physically demanding, and sometimes, better than I, the body creates smells that are just not pleasant. And nurses get in there and put all of that aside. Put all of their, it seems to me, you get in there and you put your natural inclination to want to distance yourself from things that are not pleasant. Let's use that terminology. But you do it anyway because of the good of somebody else. And that care is, I'm having a hard time finding a word other than admirable. And it is a way in which your servanthood demonstrates a kind of leadership in that you're not leading from the rear, you're leading from the front. You're not avoiding the difficult, you're digging into the difficult. I think first responders, the same kind of thing. People that will get in and do the difficult task and get their fingers dirty, get their hands dirty, as they say, right? For the good of someone else, that's leadership. And I think that's what Mary is experiencing here. Let's remember, this was a tremendously trying time for Mary, because here she is, pregnant with the child of the Most High, and she knows the emotional and the cultural ramifications of that. And yet, she says, hey, you've had favor on your servant. It's worth remembering. All right, so next time we're going to talk for just a few minutes about some connections with other religious texts or ideas, and it'll be fun, I think, to expand our minds a little bit outside of this Christian tradition that I know, I think fairly well.